practicing here in Medcare medical centers and hospital. My specialty as a dermatologist and aesthetic medicine. I graduated since 12 years almost from Cairo University, and I did my master as well in Cairo University. Later I did my subspecialty in aesthetic medicine in Glasgow, and then I started later specialty at Chicago. Since that time, my passion is aesthetic medicine, and I investigate and search a lot in that field. And I do believe that non-invasive techniques in aesthetic can do a lot, and we can avoid the knife of surgery as much as we can. Dermal filler is a procedure since long time now, and it achieved a good result, and most of the patients with dermal filler with different kind of fillers, they are quite happy. And I think from my experience, no one started dermal filler once and stopped. They always want us to repeat it because they like the effect, they like the natural effect, they like to keep themselves with useful look. See, like everything in the medicine field, every day there is stuff new, and a lot of company, a lot of researches have been done. Usually we are classified as a filler to 3 categories. The first option is permanent filler, like polyacrylamide gel and this stuff, and most of the dermatologists and the plastic surgeon don't prefer this kind of permanent filler because after a long time they discovered that it has a lot of side effects. Then the category of semi-permeable or biostimulant like Sculptra, like Radiesse calcium hydroxide apatite, which is an amazing kind of filler in terms of safety, and it gives long-term effect as well. And it gives natural look. We cannot also forget or neglect the part. It's not only giving a volume for the face, but because it's biostimulant, it stimulates their own cell to form more collagen, so it will help as well in the skin complexion and the skin texture. The last thing, which is temporary, which is something like hyaluronic acid, is a very successful filler as well, and it gives a nice result, but definitely we cannot compare something very temporary like hyaluronic acid by biostimulant like Sculptra, like calcium hydroxide apatite. Okay. There is something new as well in that category called the Lunatus, but it's not too much research that has been done on that filler. Usually the people which are mid-age, is not so old, first time for them to go for such a procedure, they are very nervous because they don't know what they should expect, even if they see a lot of things in the internet or YouTube. So really the doctors have to give such amount of time with them to discuss all their concerns. For me, what I would prefer, especially first consultation with the patient, first of all to listen very well about the patient concern. We have to have some sort of communication first to see what exactly makes them concerned, because sometimes it's not their concern. For example, fine line, which is not treated by dermal filler. The patient cannot differentiate what exactly they need to do. So the way of discussions and explanation to the patients what they're going for, this has, I can tell, more than 80% of the successful treatment of the patient. After that, we do full assessment for the face to explain where is the weak point, what they need to do, what they should expect, what any side effects possible to happen. We can give after that, when we see the patient a little bit hesitating, we give them some time to give them some websites to go through it, to do it as homework before they take decision to do the procedure. See, first First of all, sometimes we see them very often because, for example, they have more than one area needs to correct. Once they correct one area and they pleased by the results, they coming soon, please doctors correct the other, and they want to do more because now they are confident about the dermal filler. I didn't see honestly any patients come to say, no, I don't want a dermal fillers, I want to do something else, because dermal filler it's a procedure, few minutes, give amazing result, almost I can tell, very confident, no side effect to mention, so why not to go through it again? This is really a very common confusion because patients come and say, I want to put Botox on my cheeks is deflated, or I feel my face sagging. Definitely it's two totally different products, two different indications, like two different things. Basically, dermal filler is something to give volume to the face, to correct any depressions on the face, to restore the face like before. But the Botox, it's something work at the level of muscle. It's weakening our muscle through its mechanism, through the nerves. What it does actually, it relaxes the muscle to eliminate the fine line, which is more coming from dynamic movement, not static movement. So simply, Botox for fine line and wrinkles of the face, and it works successfully for the upper half of the face. Filler or dermal filler, it's something to give volume to the face and to give more tone to the skin. I used to, first of all, to have quick history about the patient, about for example, their social life, their work, because give us an impression what they are exposed to do or what is the suitable treatment for this kind of patients. It's very important to us to also to know the diseases history, if they have anything running of the family or they have any kind of chronic diseases like diabetes, like hypertension or whatsoever of chronic diseases. Very important to know if they are a smoker or not. So we are going through their personal history quickly. After that, we need to know their complaint first, and then we started our assessment. And first we will hear from the patient, and then we will start to do full assessment for whatever their face or for their body or their area of concern. When we are talking to the face, usually we divided our consultation to 3 levels. First of all, we are talking about the skin, the healthy skin. If they have any problem in superficial skin, like pigmentation, like acne scars, we will go through all of that and how we can manage. Then we are talking about the facial contouring, and here it comes the role of filler and Botox, which is the shape of the face itself, not the skin. If they have something like mid-cheek depression, or it has something like nasolabial folds, or the marionette line, or whatsoever, we will go to discuss it and we will offer them the options we have, what is filler they can use it, what is the side effect. Later on we can check on the muscle, because also when we tone the muscle of the face, it gives kind of lifting, and there is some machine now working on the skin and muscle tone as well. Actually, we're gonna demonstrate hand rejuvenation, and really this topic, it's my interest because since almost 2 years I saw a photo or our interview for celebrity Madonna, and actually it was immediately after some aesthetic procedures. I impressed by the job had been done on her face, her neck, the way she dressed. She looked really fantastic, but suddenly took my attention her hands. Her hands looks really aged. And actually, maybe in the area we are practicing, most of the ladies, even men, are not giving such concern to their hands. And if you look, hands presents the personality as well. So for me, hand rejuvenation as a topic is something very important, and I need to highlight it, and I need to draw the attention of the patient to such thing, because sometimes you see a wonderful woman, you feel that she's young, end of 20, beginning of 30, wants to look to your hand, you discover quickly her age. Why not to take care of everything? If something very safe like calcium hydroxide upside, like what we're going to demonstrate today, gives a nice result. It's not term only on the volume of the hand, but also solve some problem of the hand, like showing veins on the hand. A lot of women come after a long trip of trying to treating by sclerotherapy and going to kind of laser, which is not successful, or end up by post-inflammatory hyperpigmentation. While the solution is very available and safe, like we can put small amount even from the filler to hide or to camouflage the veins. For the time being, I'm practicing long Medcare. Basically, most of my time I'm in Medcare Clinic at Mirdif City Center. I'm practicing as well in Jumeirah Clinic, and sometimes I'm going to JBR. No, only just I wanted to highlight it to the all men and women that the aging process is something, in my opinion, it's something, it's not only you can prevent it, you can reverse it as well by very safe technique, but all what you need to have more information through the internet, or when you're going to consult your physician or your doctor, you have to give it such time, because this is the core thing for successful treatments. Today we have Madame Mary. Her main concern about her hand is the vein. She don't care about the volume, because actually, as you see, she has a good volume in her hands. So basically, what we're gonna do put small amount of calcium hydroxide appetite at both hands, as first of all to cover the veins, which should and bother the patients. Number two, to rejuvenate the skin as well. As we see here, we started to put some now cream, topical cream. In terms of amla cream, it's gonna be fine. The patient, hopefully, it will be very comfortable during the procedure. If we are using the Radiesse for the face or nasolabial or any area of the face, it's up to the doctor if he wants to dilute or not, it's up to him. But for the hand, we would prefer to dilute, to have a smoother filler to be distributed, because now, as you're gonna see, is that we will inject it by porous technique. So we need the material to be soft enough to be distributed all over the area we need to inject. On the other hand, because we can mix it with little bit with lidocaine, so it will give comfortable to the patient while we are injecting. This point I need to highlight it in the hand. We would prefer, when we mix the Radiesse, to mix it with lidocaine without adrenaline, because the adrenaline, as you see, it makes vasoconstriction, which sometimes we need it while we inject it to make vasoconstriction. For the hand, no, we need to keep the vascularity of the hand. It will not give such effect, but as more precautions because the vascularity of the hand is extremely important. Here what we have, we have almost 0.2 ml of lidocaine without adrenaline. We're gonna mix it with 61 syringe of Radiesse. Radiesse here is very nice, and as you see, it's 1.5 ml. Call it female to female cannula. It's a very easy thing to do it, but the most important to mix both things very well. So you need to push at both sides, we can say like 30-40 times. The Radiesse is ready for injection. in terms of volume it's fine, but here she has very prominent vein, so this is what we're trying to hide him. For her it doesn't need a big amount of filler, so what we're gonna use by maximum is 1 syringe. We will divide it at both hands, half in each hand. Usually with the hand, even if the patients need more than 2 syringes, means 1 syringe in each hand, we prefer to do it in 2 sessions, not in 1 session, because otherwise it will be big volume, it will give a lot of pain to the patient, and sometimes it will affect the hand and finger movement. So we have to be very cautious with the hand. Per session we cannot inject more than 1 syringe at each side. To see exactly where we will place our bolus, and then we'll distribute it. We need as much as we can to try to avoid the vessels, to avoid hematoma. So now we plan to inject half of Radiesse syringe in this hand. We'll try to put it in the depressions, near little bit to showing vessels, and then we're gonna distribute it. We are applying some ice as adding method for anesthesia. Here what we can do, just we are holding the skin up like this, and we will go inside. Okay, and we are injecting amount. So here is the first bolus we put it. We put another one here. So now we need to start to massage it. Every now and then during injection, it's better to check how much you already placed it in the place. So we're almost done. It's a very quick procedure, it doesn't take few minutes, and it gives such nice results. So after we finish, we need to keep ice for a while. We prefer after the injection to put little bit ice for 5 or 10 minutes, and after that we're gonna place the final cream, which is topical antibiotic. patient here is asking me about the precaution after the injection. Actually, there is no too much precaution, except she has to keep the hygienic of the hand, because as we know, hand we use it a lot to do many things, or exposed to many things, and here there is a place of injection, so at least we will give her topical antibiotic to use it for coming 3 days and to massage it a little bit. Sometimes we are asking the patient to put their hand under them and sit for a while as a kind of pressure of hand to make sure that the dermal filler is distributed well in the hand. But otherwise, it's a very minor procedure. It doesn't need any specific precaution. Here again, we are checking the hand. We are putting our marks to see exactly where we need to inject. We're gonna give the ice for a while and we will put the rest. You have this here in this syringe. No, the syringe which has this here. Put this amount inside as well.
عادي لو تقطع أو شنطة.
Everything is okay. The only thing إن أنت هتاخدي بس topical antibiotic to apply today and tomorrow. By the same way, we can inject the other hand. We are holding the skin up to have light groove, as making a track of the needle. At the same time, we are making sure that we are not breaking any important structure underneath. We would have syringe in each hand, and we can examine here after 7 to 10 days. If it's need any top up, we can add it at that time. With alcohol, and she's gonna apply kind of topical cream. We can use something like fusidine cream. It's gonna be fine with Turban, and we will advise the patients just to massage it a little bit the rest of the day and to apply the antibiotic cream a couple of times for coming 2 days. Russell has some concerns about her face. Basically, she started to complain from the area under the eye. She had the beginning of mid-cheek depression at this both side and the beginning of nasolabial fold. But the issue we need to pick it from the first look that she has a bit asymmetry between both sides of the face, and this is very common with most of the people. They have asymmetry, but the degree of asymmetry, this is the issue. For Madame Russell, she has a mild degree of asymmetry, and this is we can correct it with filler as well. We will use calcium hydroxyl apatite. We will mix it with some lidocaine with adrenaline to be more softer while we are injecting and to give a bit of comfortable to the patient. We'll start on this side first to correct the point we discussed. When we are planning to correct the mid-cheek depression and nasolabial fold and marionette line, it's better to start with mid-cheek depression, because once you correct the mid-cheek depression, definitely it has a positive impact in the nasolabial fold and the marionette line as well. So even if you need to put filler in that places, so you're gonna need less amount. So usually we are starting in mid-cheek depression if the patient has it. Again, I would prefer, even she had the amla cream for like 20 to 30 minutes, but even before the injection I would prefer to apply some ice at the place of pricking to give more comfort to the patient. Usually the bevel down. Going deep subdermal, and in this issue we can go supraperiosteal as well. Okay. And we are injecting retrograde. Here in the zygoma to give more lifting to the nasolabial fold. Retrograde injection, fanning technique. Trying to correct a little bit of asymmetry of the face, because if we look here, she's fuller here than here. That's why I put little bit on that side to make balance with other side, and at the same time it can give little bit lifting of the marionette line. Usually, it's better to assist the face while you are front view of the patient to check how it is, how it looks, if any asymmetry or not. Now we started to do the other side. Subdermal or supraclavicular, retrograde injection. Now we're done on both sides. We'll clean, we'll put the topical antibiotic and we'll دي أعلى. Usually with asymmetry we need to correct the basic first and after weeks or 10 days to check again if she needs any top-up. Actually, the dermatherapy can correct asymmetry of the face very successfully, but sometimes the issue is more complicated, whether it's related to the bone of the skull itself or the mandible bone itself. But the filler, more or less, it can achieve a satisfactory results. And here, if we look at Madame Rosser, what we used almost 2 syringes. We put more than 1 syringe here, and the remaining we put it at the same side. And I think more or less the asymmetry became less obvious. And here at the mid-cheek depressions, it's not showing anymore, and she has very good significant improvement on her nasolabial line. So now we will just apply the last thing. We will apply the topical cream, and we will advise her to use the eyes for coming 1 hour, and that's it.